Hello everyone. Today we are going to see about hernias. Even though I talk about the different hernias, I will be giving you a general outline about hernias which are commonly asked in USMLE, and even if you are a medical graduate, this knowledge is a definite must know. So beyond it is up to you, but at least this one must be thorough. So let's talk about direct inguinal hernia. In a direct inguinal hernia is something where the hernia will pass through the Hasselbalch's triangle. So what happens is that the hernia can pass either through the deep inguinal ring, superficial inguinal ring, and then it can enter into and through that it can form the hernia. But otherwise, if there is any weakness in the abdominal wall, then it can pass directly through that weakness. So, direct weakness in the abdominal wall is formed by this Hasselbalch triangle. Hasselbalch triangle is formed by inferior epigastric vessels as well as superior to the inguinal ligament. So, the hernia will herniate medial to the inferior epigastric vessels but superior to the inguinal ligament. So here this direct inguinal hernia is much more common in those who have weakness in abdominal wall musculature, typically in older men. So when you see they will be presenting with palpable mass in the groin when the patient lies down, which will worsen with cough. And the mass will reduce when the patient lies down. The physical examination will confirm hernia and the location will be medial to the epigastric vessels. Elective hernia repair is recommended unless there is any strangulation or incarceration happens, because if there is strangulation or incarceration, that means the part of the content which is also herniated, say for example colon or any other, that part blood supply is compromised. Therefore immediate surgery should be performed, but elective hernia repair is generally enough. That is recommended. What about indirect inguinal hernia? Indirect inguinal hernia will pass through the deep inguinal ring and then it will enter. So therefore here will be the inferior epigastric vessels. This will be lateral to the inferior epigastric vessels and superior to the inguinal ligament. So that is common in both, but lateral to the inferior, that knowledge will be asked. So either they will be giving you a clinical presentation of a direct or indirect inguinal hernia, and they will ask you where exactly the hernia is, whether it is medial to the inferior epigastric vessel or lateral to the inferior epigastric vessel. So this hernia which passes through the deep inguinal ring, that occurs because of patent processus vaginalis. This can result from patent processus vaginalis. The same mechanism causes hydrocele. So here the elective hernia repair is indicated unless in all hernias. But if that is an hydrocele, then it can be observed until age 1, because the patent processus vaginalis can get obliterated on its own. How do we diagnose that the indirect and the direct inguinal hernia clinically? When the indirect inguinal hernia has to pass through the deep inguinal ring. So when a pressure is it can be reduced with the pressure over the deep inguinal ring. What about the femoral hernia? Femoral hernia, it has a lateral border, a medial border. Medial border is the lacunar ligament which defines the medial boundary. Lateral border is formed by the femoral vein which forms the lateral boundary of the femoral canal. And the anterosuperior will be inguinal ligament. This is the difference between the inguinal hernia and the femoral hernia. Femoral hernia happens under the inguinal ligament. So inguinal ligament creates the anterosuperior boundary, but in inguinal hernia, the inguinal ligament will form the inferior boundary. What about the posterior border? Posterior border is formed by the pectineal ligament. So this femoral hernia is most common in women due to wider pelvic anatomy. Surgical repair is necessary. Spigelian hernia is a hernia which occurs, it is a rare type even though it is rare, the knowledge is tested in MLE exams. This occurs lateral to linea semillunaris. So that is, it happens in the medial border is the rectus abdominis. The rectus abdominis ends as linea semillunaris, isn't it? So in that area you will be having a hernia, which is the Spigelian hernia. It is, they might even give you a CT and ask you about this hernia type. There it is. It is enough if one can identify the rectus abdominis muscle, and lateral to it, that is in the linea semillunaris, we will be able to find out this Spigelian hernia. Umbilical hernia can occur, it is mostly associated with congenital hypothyroidism in children. It is present in the umbilicus area. There are two associations with the umbilical hernia. One is the omphaloceal, where omphaloceal will be covered with the membrane, but umbilical hernia will be completely covered by the skin. The other one is the gastrochisis, which will not be covered either with the membrane or with the skin. Both omphaloceal and umbilical hernia can indicate trisomy 13, 18 or what is a paramblical hernia? As the name says, this herniates through the linea alba, but superior to the umbilicus. So this is also covered by the skin. That is the distinction between gastrochisis. Gastrochisis will have no covering. Gastrochisis as well as omphaloceal can be associated with trisomy 13, 18 Beckwith-Whiteman syndrome. What about epigastric hernia? Epigastric hernia is also again the protrusion through the linea alba, but in the epigastric region, much more higher than the paramblical hernia. It's a mechanism, is a similar mechanism to paramblical hernia. Both can occur because of the weakness to the linea alba. Incisional hernias are hernia which can occur at any abdominal incision site. This is caused by poor wound healing. What about obturator hernia? Obturator hernia is a rare pelvic hernia where the small bowel will protrude through the obturator foramen. So there will be, since it protrudes through the obturator foramen, there will be lancinating pain in that region, that is in the obturator foramen region, which is present in the medial thigh with the leg involvement. So the house-shaped Romberg sign is pathognomic, where there will be thigh extension, medial rotation and abduction will cause severe pain. This happens that this maneuver is Hauschig-Romberg sign, and any pain with this maneuver indicates obturator hernia. What about a sciatic hernia? Sciatic hernia is when the hernia occurs through greater or the lesser sciatic foramen, then that is the sciatic hernia. It mimics sciatica due to nerve compression. There are some other rare hernia types like lumbar hernia, which can happen in the lumbar region with the pain and herniation in the lower back. There can happen perineal hernia because of the pelvic floor muscle weakening or the levator muscle atrophy that can result in a perineal hernia.